Hello, everyone. Good afternoon. Thank you for joining us today for our third day of Nurses Recruitment Week. Today we have Los Angeles General Medical Center in AltaMed. The way the session is going to run today, each organization is going to have 20 minutes to present, followed by breakout rooms Q&A. We're going to go ahead and pass it over to Los Angeles Medical Center. Take it away.
Thank you, Juan. Good morning, everyone. My name is Sina George. I'm a nurse manager overseeing the nurse recruitment office at Los Angeles General Medical Center. And joining with me is Cynthia Franco Marquez. She's also a supervising staff nurse one and a nurse recruiter. And Leah Salinas. She is director of nursing operations. Little bit about myself, then I will hand over to Cynthia and Leah. Then we will do a small presentation of what we are and how we are working here, and then all those stuff. So my name is Zina. I've been in the LA County. This is my 27th year. I started as a staff nurse in Los Angeles General Medical Center. Then it was a general hospital. Now that we changed name to Los Angeles General Medical Center. And I worked in med-surg unit, 5 years in a medical surgical unit in the old hospital. Then I moved to primary care clinics. I worked there almost 13 years. And now I am overseeing a nurse recruitment office. My functional title is also a nurse recruiter, and we always bring new people on board and promote our existing people. And like I said, I started as a staff nurse and I got all my promotions in the hospital, and I never leave here. This is my 27th year. That's about myself. And I will have Cynthia and Leah introduce themselves, then we will do the presentation. Cynthia, would you like to go ahead?
Yes, good morning, everyone. Thank you for having us here. My name is Cynthia Franco Marquez. I am a supervising staff nurse here at LA General. My functional title is a nurse recruiter, and I do, Zena is my boss, so I do work under Zena, and we hire all the nursing staff for the nursing department. I do focus on all the support staff, which is going to be, for example, clericals, CMAs, LVNs, surgical techs, any additional central service technicians, dental assistants. So any support staff, that's my focus. Me and Zena right now are sharing the title of hiring all the registered nurses. We did recently lose a recruiter. So Zena and I are going to be working on those to hire for the county. Los Angeles General, just a little background about myself. I did start 11 years ago with, formerly it was called LAC-USC Medical Center. I started in the outpatient clinics. I was a registered nurse one there. And then I did get promoted to a supervising clinic nurse, and I supervised about 3 to 4 different clinics, and I did that for 3 years before I moved over to nurse recruitment. And I've been here with Zena for about 6 years, and the time's gone by really fast. And I enjoy everything I do, and I enjoy working here. I'm going to go ahead and pass it over to Leah, let her introduce herself, and then we'll go ahead and start our PowerPoint presentation.
Hello, good afternoon, everyone. I'm Leah Salinas. I started here in county since 1997. Before I got promoted as an assistant nursing director for nursing operations, I used to work in surgical ICU for more than 15 years. And then I also work in med-surg, became a nurse manager in one of the med-surg unit, which is hemodialysis unit. And I also at interventional radiology and transferred to medical ICU during COVID time. And now I help with, my function as an assistant nursing director in nursing operations. I look at productivity, overtime, any expenditures, and I support item control also in, hiring staff nurses or registered nurses. Thank you for having us.
Okay, Zena, I'll go ahead and start.
Okay, yes.
Okay, perfect. So everybody can see? Yes, everybody can see the PowerPoint?
No, not yet. Oh, yeah. Yes.
Yes? Okay.
Mhm.
We are representing Los Angeles General Medical Center. We are under the Department of Health Services, the Los Angeles County Department of Health Services. Right now in the office, it's going to be Zena and I as the nurse recruiters.
Cynthia can, oh,
Yes,
okay.
you can hear me?
Yes, yes.
So the Department of Health Services was formed in 1888, and we operate 26 health centers and 4 acute care hospitals. We manage the Los Angeles County Emergency Medical Services, it's the EMS agency, and the county's 911 system. We oversee healthcare services within the juvenile justice system and LA County jails. We're the second largest municipal healthcare system in the nation, and we're the largest Los Angeles County employer. We employ over 23,000 people per year, and we provide services to over 750 unique patients, and we have over 2 million patient visits per year. For Los Angeles General Medical Center, we are centrally located in East Los Angeles. We're one of the largest public hospitals in the county with a 600 bed capacity. We are a level 1 trauma center, a level 3 neonatal intensive care unit, a primary stroke center, and a STEMI receiving center. We have the most advanced burn center in Los Angeles County, and we're affiliated with Keck School of Medicine of the USC and LA County College of Nursing and the Lighthouse. We are a premier academic teaching hospital in the nation and one of the state's leading hospitals for training health professionals. We have a training for U.S. Naval Corpsmen, EMT personnel, and more than 900 physicians annually. Awards and achievements. We have several awards and achievements that our hospital has gained. So we have gained a magnet recognized by the American Nations Credentialing Center. We also are a Beacon Award for Excellence for American Association of Critical Care Nurses. We have the Gold Award for 4B Medical ICU and 5B Surgical ICU, a Silver Award for 4C Neuroscience for the Burn ICU, a PCU, Medical ICU, Coronary ICU, and then we have another 4MPCU 5A SICU, and then 5D Burn Medical Surgicals. We also are Joint Commission accredited for Primary Stroke Center. We are a baby-friendly hospital. We're designated since 2012, and we, according to U.S. News and World Report, we're a high-performing hospital for heart failure. We also have health grade awards, America's 100 Best Hospitals for Coronary Intervention, and we have Coronary Intervention Excellence Awards. We are also top 10% in the US for cardiology.
And next, our advantages and benefits. Why we are staying here and not leaving county 25, 26, 30 years. Some managers and then directors 35 years retiring from service. Then we have a service award coming up in June for 25, 30, 35, 40, 45, 50, and 55 years. That's employees are staying in county and not leaving because of our flexible benefit plans. We have 100% medical coverage, dental coverage. These are for you and your family and loved ones, your spouse, your significant other, all are included in your medical coverage. And the dental coverage is also 100%. We have group life insurance, AD&D insurance, healthcare spending account, long-term disability health insurance, and subsidized dependent care spending account. This is all provided by the county, which is your employer. You get monthly allowance by county. You don't have to pay anything out of pocket. You have enough for all these coverages when you have the monthly allowance provided by your employer, and some of them have an extra cash after you enroll in all these plans. Those extra cash is not going back the employer don't take it back, it will be going to be in your pay stub. So these are the benefits of working in county, and there are more benefits. We have bonus pay. As an RN, we have an evening shift differential, night shift differential, weekend shift differential, and bilingual pay. This is not only for the RNs, this is for all employees. Bilingual pay is also is one of the incentive the county allows, for whomever speak any other language other than English. You can go to our HR to get certified for speak, read, write, and speak, and you will get that bilingual pay monthly. Next one is a paid time off. We have an average of 13 paid holidays per year. This is including that October there is a holiday in October, and it's March there is a holiday, and also we have a holiday coming in June 19th, which is Juneteenth day. None of the other employers I know of, my family, some of them working in private, they get a maximum of 6 paid holidays, but then we have 13 paid holidays per year. And we have paid vacation as a permanent employee 2 weeks after you complete your 1 year of service, and 5 weeks after 25 years of service. And we have sick leaves, which accrued monthly, 12 allocated per year, 12 days, which is 8 hours per day. And also FMLA, Family Medical Leave Act, included for all county employees, for yourself, or for your health, or if your family member, you are taking care of a family member, you could apply for the FMLA. Bereavement leave, 3 to 5 days paid leave, 3 days if you are in state, and 5 days if you're out of state or out of country. And jury and witness leave is a paid leave. How long, whichever days you are in court, the employer paid for you. It's there's no cap for witness or duty. And the other advantages are retirement plan. This is why we are not leaving county, because we have our own retirement plan. We don't pay to Social Security, but then we have our own county pension program, which is called Los Angeles County Employees Retirement Association. There are two types: contributory or non-contributory. Contributory means you pay something from out of your pocket. When you retire, you are retiring with a huge amount. But then the other one, you don't pay anything, but then your employer will still pay monthly, and you still retire with a reasonable amount of money. That a lot of our employees are retiring with either contributory or non-contributory plans. The county has other plan, which is the optional retirement plan, is called Horizon Plan, which is optional plan. You could enroll or you don't need to enroll, but then we always encourage us, and recruitment staff, we encourage all the staff to enroll in this plan, because the employer matches 4% of your salary if you enroll into the Horizon plan. But then if you don't enroll, or you are not willing to put 4%, the employer don't put that 4%. So we always encourage every new hires to enroll into this plan also, because you only put 4%, and then your employer matches that 4%. So whatever free money that you get it from the employer, you might as well take advantage of that. So we always encourage the employees. And then there's another plan when you are in a management or higher, like managers, directors, they get 401k also. So we have like 4%. If you put 4%, you get 4% matches from your employer. So that is the another advantage. And the other advantages: tuition reimbursement and national certification reimbursement. Unfortunately, tuition reimbursement is not no longer providing. I don't know, maybe start soon, because of our financial situations. Tuition reimbursement is temporarily as an paused right now, but national Specialty certification reimbursement is still ongoing. And other services are, we have childcare services offered for people work daytime. It's only Monday through Friday. And like I mentioned earlier, there are a lot of professional and promotional growth. We all started as a registered nurse one. Now we are in this position where we are. So there are a lot of opportunities at Los Angeles General Medical Center. And these are our recruitment staff. We are only three staff right now, myself, Cynthia, and our clerical staff. And then this is our email address. If you could take a screenshot, whomever would like to inquire or to call us, you could take a screenshot of this one or take a picture of this slide, and you could contact us. And we will show our website. I don't know if there's time to go to the website, but this is our website to apply, hr.lacounty.gov, and you apply through this website, and then the application. Cynthia could show you the application just for a few minutes, and then I know that our time is not that much. So
Let me go ahead and pull that one up.
are you able to see it?
Let me.
Yes.
Yes, you can see that one.
Yeah. So this is our website, and so this is you just when you put hr.lacounty.gov, you are getting to this website, and you will see that there is two tabs here, yellow and red. And when you are an outsider, you click into this tab, the one with
It's not showing, Sina.
Pardon me?
It's not showing on my side.
Oh, it's not.
You can put it.
Do you have the screen, Cynthia?
Let me go ahead and share.
Uh-huh.
Okay, everybody can see mine?
Yes.
Yes.
Okay, so perfect. So this is the hr.lacounty.gov here. If you go ahead, this is our main HR website. If you scroll down, you will see two boxes here. The yellow box says looking to join LA County, and then this is for LA County employees. So you're going to go ahead and click on Find All Jobs. When you click on here, it will give you a search bar. It tells you how many jobs we have right now, 326 jobs, but you want registered nurse. Registered nurse 1. And what's going to pop up is this registered nurse 1/relief nurse, and it's going to tell you it's for health services. If you click this link, it will tell you all the information about it. It tells you the beginning salary. So if you're a new grad, you will be starting at the base pay. We do have 20 steps. So every year you go up a step until you get to the top pay. That's why you want to stay here for long term. It tells you it's a full-time position and it's for health services. This is your job number. Up here at the top, it does give you the apply. So when you click on that, it will have you create a profile, and then you can start putting in your information for your application. If you scroll down here, it does give you information about Los Angeles Department of Health Services. It gives you our mission, and then classification standards, and then essential job functions. So you can review that on your own. We don't have time for all that. But I do want to point out the selection requirements. It does say that you need a license to practice as a registered nurse by the California Board of Registered Nursing. and you need a current basic life support for health care providers, and that is to be issued by American Heart Association. So these are the two requirements that you need to apply. Once you take the NCLEX and you get your registered nurse license, that's when you can go ahead and apply. They won't accept your application until you actually get your license. If you do happen to apply, you don't have your license, your application will get rejected, and then you'll just need to resubmit another application once you have your license number. If you scroll down, I do want to point out it gives you right here exam content. So you do have an exam that you will be taking. It's a personality work style assessment. As soon as you apply, you should be getting that no more than 2 weeks. If it's more than 2 weeks, I will give you the contact person so you can reach out to them. Once you pass that, then you get put on an eligibility list. Once you're on that list, that's when we can go ahead and schedule your interviews. If you come down, it gives you exam preparation. So it does give you a link to go and practice for this work style personality exam. So you can go ahead and do that before you take the exam. Go ahead and read through all this information. I do want to point out the exam analyst. We do not have here at Recruitment, we don't have access to the exam, so we won't be able to know if you were put on the list. The person to contact would be Darlene Beeman Thomas. And then this is the HR phone number. So if you do need to contact her, this is a general HR phone number. You can reach her out. They'll give her a message. She'll give you a call back. But the best communication would be through email. So you can email her. She does get you on the list pretty quickly once you apply. Once you're on the list, that's when you can go ahead and interview with us. So you can reach out. You have our email address. And once you're on the list, you can go ahead and email us and let us know that you're on the list and you're interested for a position. You can also call our office if you have any questions, and we can help you on how to set up an interview as well. I'm going to go ahead and open up for questions, or Zena, if I missed anything.
I think you've covered all, and we will wait for at the end. So for now, yeah.
Yeah, we'll do Q&A at the end.
Okay.
Thank you, LA General Medical Center. We're moving right along. Next up, we have AltaMed, Stephanie Engsi and her team. Go ahead, AltaMed.
Hi, good afternoon, everyone. We'll just go through, there's three of us here that are representing AltaMed, and I'll start by introducing myself. My name is Stephanie Ingse, and I'm a family nurse practitioner. I've been with AltaMed for 10 years, and I've been an NP for 11. And so our slides today are primarily for people who are family nurse practitioners or in training, or who want to know more about that, that role. Pop over to Dr.
Good afternoon, everyone. I'm Dr. Michael Granados, MD. I actually trained at Harvard UCLA, so a lot of fond memories of county. I am the program director of our Nurse Practitioner Fellowship Program. Welcome.
Thank you, Dr. Granados. Good afternoon, everyone. My name is Sandra Sanchez. I have been with AltaMed now 7 years, and I serve as the program manager for our Nurse Practitioner Fellowship Program, mainly focusing on the day-to-day and the operational side of it. And we are going to share our screen. So please let me know, get some thumbs up if you all can see our PowerPoint. 1 second, please. Can
Thank you,
everyone?
Sandy. So as Stephanie mentioned, this program is intended for nurse practitioners or anyone that is interested in becoming an NP. So for any of the RNs out there that want to continue with training, this is a program that will be eligible and available to you. So we are AltaMed. AltaMed is one of the largest federally qualified health center on the West Coast. We actually have 60 clinics throughout Los Angeles and Orange County. It was founded in 1969, and at that point, it was a volunteer-based clinic. Our mission is to eliminate health disparities by providing exceptional quality service to human services through an integrated world-class delivery system for Latinx, multi-ethnic, and underserved communities in Southern California. Our core values are that patients always come first, employees are our most valuable asset. We want to encourage excellence and innovation for quality outcomes. We want to make sure that we promote wellness and advocate for strong and healthy communities. And we want to provide integrity, honesty, and respect in all of our endeavors and a commitment to teamwork. Next slide. So who do we serve? We have over 80 sites throughout Los Angeles and Orange County. We have about 3 million annual visits a year throughout our organization. We now have around 600,000 patients that we serve throughout all of our clinics. 70% are Latinx, and 50% actually fall below the poverty level line. We have, I think now it's 6,000 employees throughout the organization, and 70% are female. Next slide. So why a fellowship, right? So for those of you that know about becoming a nurse practitioner, we know that schooling's only 2 years. And a lot of our NP students have said it's not enough, right? They want more education, they want more training to really feel comfortable going out into the real world and seeing patients independently. So this is a 12-month fellowship. And we want to make sure that we do provide a comprehensive and well-rounded experience to get that breadth of family medicine. Next slide. So as we stated before, our program mission is to recruit, train, and really retain our family medicine nurse practitioners that are really dedicated to the mission of eliminating health disparities in our community in Southern California. Our intention of the program is to really develop competent, compassionate, and culturally sensitive nurse practitioners. We want to make sure that we do equip you to deliver comprehensive skills that really provide the breadth of family medicine and really tackling not only preventative care, but really chronic disease management. Next slide.
So I'll go over briefly how our program is organized. The majority of it is going to be spent in continuity clinic, where the NP fellow has their own patients under their own schedule. 1 day per week is going to be spent in specialty clinics. Another half day is spent in like didactics, which is like our formal learning component of the program. So there's like lectures, there's case studies, and then there's another part that includes like mentorship clinic as well as a QI project. All the specialty rotations are within AltaMed. They're at different sites, but this is a list of the ones that we have opportunities to visit. And one of the cool things is that as during the fellowship, you start very slowly. So to start, you'll have 8 patients per hour. 8 patients per day. So that's 1 per hour. And slowly, as the program moves on, we'll reach a maximum of 21 patients per day, which is the number that a full-time provider at AltaMed is expected to see. Okay. Along with coming, with working for a larger organization, there are lots of support that comes along with working here. So things like access to UpToDate, there's grant rounds, there's case reviews that we talked about, journals that are all available to employees of AltaMed. It's also a paid position, so it is a lower rate than a new grad NP would make starting out of the gate, but that's to account for the ramp up, the less throughput that a fellow would see. But it is a paid position, and that also includes full benefits like medical, dental, and PTO accrual. It also includes CME benefits and attendance of the CANP conference. Sandy, you're muted.
Hi, can you hear me?
Yes.
Okay, perfect. So we just wrapped up our recruitment for our fall cohort. We begin every fall a new cohort. This year will be our sixth cohort that will begin in October. So if you're interested and the deadline passed, you can definitely still apply for next year. Or if you know anyone that's interested, or maybe you will be graduating next year, this is our timeline. It begins every fall in October. We have two primary training sites. So we have what we call our Huntington Park Rugby Clinic, which is more in like the Southeast LA part of Los Angeles County. And then we have our Westlake and Third Clinic, which is near more downtown LA, near MacArthur Park. So those are where we hold our continuity of clinic. So 3.5 days are spent at this primary location, training and seeing your own patients. It is a 12-month program, so it is a full year of training and from October to October. And like Stephanie mentioned, it is a full-time position. So it is a Monday through Friday, typically 8 to 5. So some requirements for this upcoming cohort, you must have had your license for by the end of July, and it would be the same, but for next year. So this would be a similar date for 20, and I see a typo here. I apologize for 2026, but this would be for next cohort 2027. And the time frame is you have to be a graduate within 18 months of the program start date. So that is, you must have graduated within no longer than 18 months from the October program start date. And we really look for those individuals that have demonstrated commitment to career practicing in medically underserved areas. We are expecting the fellows to continue employment at AltaMed after they complete their fellowship. And we've been very fortunate to identify employment opportunities for all of our fellows that have wanted to stay with us. To date, we have trained 20 that have graduated and completed the program, and we have retained 17 MP fellows that are still working with us 4 or 5 years later. They're still here with AltaMed, all 17. So we like to think, they are happy with us here at AltaMed and want to continue having that support from us. And the 3 that didn't stay with us is because they moved out of our service area, so out of like either LA or Orange County. And with that, I think we're going to hand it over to, I believe, a general Q&A for everyone. But thank you so much for attending our session. And if you have any questions, I'm sure we'll put our contact information in the chat box.
Thank you.
Thank you, everyone. Very informative. We're going to go ahead and open the breakout rooms. Let me go ahead and do this here. Oh, let me stop the recording now.